happens, like whenever we lose motion here, the body still has to move, and so what will happen is this will lock down, all of that motion starts happening in the back.
Okay.
So then we end up with, like you'll see that humping in the mid-back, or we have pain here. So a lot of times you can take your fingers and if you run them down the spine, you'll hit a spot where the skin will curl up. That's just it's called a paniculus response, but it's just showing an area that's inflamed. You see it on horses a lot. But yeah, so we'll get a lot of irritation here because of the lack of motion here.
Okay.
Because the hip is acting the way it is, I can't change that, but what we can do is put motion back into the pelvis to try to help ease some of that pain, help with that compensation, but then also make sure this doesn't get any worse.
Okay.
Because what will happen is that will get to a point where it just is grinding and it gets irritated, and then it becomes a really, really sore spot.
Okay. So will that ever go away?
It depends. I have seen it go away in some animals, but it just kind of depends. If he's constantly compensating every time he walks, then it's going to continue to create that area. One thing you can do, which is a great exercise, is swimming. Swimming them is phenomenal for their joints. You're not weight bearing, so there's no pain with just standing up. It's going to put the joints through all the range of motions that are normal, and then that will help just pull some of the inflammation out of that area as well.